Hey everybody, this is Adam from Grow Life. How y'all doing today? Today's topic is going to be what to expect with an abdomen and pelvis CT. CAT scan and CT, we use them interchangeably. It used to be CAT scan back in the old days. Now typically you'll hear people say a CT scan. It stands for computerized tomography. So first of all, you walk into this room and you might be like, oh my gosh. Usually people mix up the MRI machine with the CAT scan or with the CT machine. All right, MRI is fairly closed in, long tube. You kind of go in, have to hold really still. I mean, you have to hold still for the CT scan as well, but they kind of look like cousins of each other because you walk in the room and it's like this big donut. It's a big circle, okay? But it's only, yay big inside. You can see the other side of it. It's not like you're going into nowhere. Big donut, there's a table, and basically that table, you get on that table, and long story short, you go in and out of the donut a couple times. That's when it's taking pictures. Now, all depending on what type of skin you have or order that you have, what's going to happen to you, depends. That will determine the length of time, the intricacy of the test, okay? But for right now, we are going to be talking about abdomen and pelvis CT. What to expect? How long is this gonna take? The scan itself, once all the prep work is done, the scan itself, pretty darn quick. I mean, handful of minutes. I mean, typically 5 to 15 minutes, in that range there, you're good. If you got a good tech that day, they're going to explain everything to you. They're going to pick up on your nervousness, and they're going to try to put you at ease. But even before then, let me try to put you at ease. It's easy for me to say. I've been around it for 20 years, all right? But take it easy. It's not as bad as you think it's going to be, okay? Now let's get to some of the hiccups that we get into with prep and what you're prepared for and what you're not prepared for. There's a lot of times there's some information disconnect for when a patient gets an order for an abdomen and pelvis CT. Okay, hey, Mr. Smith, I'm gonna send you for an abdomen and pelvis CT. You've been having this unspecified abdominal pain, and I can't rule, I can't tell with the blood work and urine samples and whatever's going on. So we kind of would like to take a look if you're willing to do that. Okay, so here's the script, Mr. Smith. Just head on over to such and such a hospital. We will call in and we'll make up an appointment for you, blah, 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 blah. There'll be instructions on your sheet. Okay. So Mr. Smith goes to the hospital next Monday for a scheduled appointment, and he has an abdomen and pelvis CT. Well, his appointment's for 1:30 in the afternoon. No problem. Okay, so, it says NPO, nothing per oral, nothing to eat for like a certain amount of hours prior to the scan. So, okay, he abides by that and follows the instructions, gets in there, and okay, so his scan is at 1:30. I mean, good grief, it can't take more than an hour or something like that, 2:30, because he has like a 3 o'clock appointment, to get his tires done at the shop or something like that, right? I mean, he's got previous stuff going on. People have lives and timing with their lives. Okay, so finally, hopefully if we're not behind, hey, Mr. Smith, I'm Adam from CAT scan, blah, blah, blah. Mr. Smith gets taken back because, let me put Mr. Smith on pause. Okay, let's back up. Abdomen and pelvis CT. We use contrast a lot of times depending on what the exam is for. Contrast, okay. Now there's multiple contrasts that we can use and that we do use and that the radiologists prefer to use for different things. A lot of times, most of the time the average is IV contrast. Start an IV and it is pumped through, and that helps highlight the blood vessels and organs, help show if there's any infection or inflammation. Kind of shows up a little bit brighter on the skin. I mean, realistically, on the atomic level, it's a little thicker than blood. So therefore, it's going to show up a little brighter because the x-rays or the radiation is having a harder time penetrating through. Just like your bone on an x-ray or a CAT scan shows up brighter, it's because it's more dense. Okay, so, years ago, they found that if we put this through your system, that it will show up brighter and they can follow the blood flow. And I mean, that's how they can help find blood clots and all that stuff. Anyway, that's what they use in the cardiac cath lab. I'm getting off topic. So there's IV contrast. Also, depending on what's going on, the radiologist might want to give you some oral contrast as well through the mouth. Okay, you drink it. It's really, depending on what institution you go to, it's the same thing as we put through your IV, only we put it like 20 milliliters in 900 milliliters of water, something like that. And what that does is help highlight your digestive system, okay? Your GI tract. It helps highlight your intestines and helps separate that out so the doctor who's reading those pictures can see it, okay? It kind of separates things out, the different systems of your body. Okay, so you have IV contrast, oral contrast, and sometimes you actually will have rectal contrast. We won't get into that. That is pretty much what it sounds like. Instead of drinking, it's going the other way. And that has its place at different times. But the majority of the time, it's IV and oral contrast, okay? So the oral contrast, though, you can't just drink that and then go in for your pictures, because what you drank is going to be right there in your stomach, okay? So what we have to do is get that spread out and give it time to go through your digestive system. So what we would do is, where I'm from, we give you drink 1 cup every 10 minutes, and there's 6 cups. So 10 minutes times 6 equals 60 minutes. So that equals 1 hour. We're back here to Mr. Smith. Hey, Mr. Smith, okay, we got all these questions answered. We're good to go. I'm going to go get you a drink because we have to get you some oral contrast for the test. All right, and we're going to need you to drink 1 cup every 10 minutes if you can, and that's going to equal an hour. And after about an hour, we will come get you. Mr. Smith goes, what? Nobody told me about that. So many times. Okay, Mr. Smith has an appointment. It's 1:30. Well, actually, it's probably like 1:40 right now because, you know, we were busting our butt trying to get the backlog of patients because ED patients outpaced anyway. Okay, all right. Even if it's on time, 100%. Boom, 1:30, 1:30. Mr. Smith is here thinking that he's going to have his scan at 1:30. We know that we are going to get Mr. Smith, finish the questions, give him his oral contrast, and it's going to be a scan at 2:30, okay? Mr. Smith has to go to the shop and get his tires taken care of at 3 o'clock. This is going to be pushing it. This is a problem. This is going to stress our patients out. This is going to stress you as patients out. If there's no information and education to the patients, they are going to get stressed out, frustrated. No one told them this. They just keep getting hit. As you probably know, if you're watching this, you keep getting hit with a surprise. What? A surprise. What? Okay, pause. Now, also, for the IV contrast, we also need to check your kidney function, how well your kidneys filter what is going through your bloodstream. Okay, we need to make sure that your kidney function is processing at a certain level. So, if you do not have lab work, a certain type of lab work drawn within 24 hours or 45 days, depending if you're an outpatient or emergency room patient, we will need to get a blood test, and they can tell with the blood how well your kidneys are functioning, okay? If it is functioning very low-key, we will not give you that contrast. Hydration is key, by the way. Hydration, before and afterwards. That's just a little side note. Okay, so if your kidneys are not functioning and filtering out well, we are looking for a GFR, glomerular filtration rate, okay? We won't give you the IV contrast because we don't want to shut your kidneys down, and I don't think you want us to shut them down either, okay? So then we work with that. So on top of Mr. Smith, you have to wait here an hour drinking 6 cups of stuff. You know, we don't have any previous labs on you, sir. We really need to send you down and get some blood drawn to make sure that your kidney function is okay for the IV contrast. So now Mr. Smith, he has to wait an hour. He has to get an IV. He might not have even known he needed the IV for the test itself. That's another surprise. To some people, they're cool with it. Other people, I mean, it would stress me out. You know, oh, shoot, you got to do what? Come on. And then all of a sudden, also, hey, we need to poke you and get some blood drawn to make sure that your kidneys are functioning good for the IV contrast. Okay, all of these things, these are things that could be prevented ahead of time of stressing you, the patient, out And if you're a provider, these are things that could be preventative to help your patients appreciate you better, appreciate the hospital better, appreciate the process better. The IV contrast. Here is where you might feel a little something during the test. I'll let you know ahead of time that with the IV contrast, it is typical that you might feel warm, okay? That's totally typical. A lot of people, they say they feel a progression of warmth. This starts like down their throat, and then they feel like they stepped into a hot tub or a hot bathtub. Some say like a double shot of whiskey, all right? I've never had a double shot of whiskey, so I don't know. And then it progresses down, and then they're like, oh my goodness, I just peed my pants. Or like their butt's on fire, you know? Warmth, basically, it's just a progression of warmth going all the way down through your system. That's all, okay? That is, sounds funny to say it, but that is typically, that is normal. All right, and then that heat, that warmth, it comes and then it'll subside. Okay, that is typical. So some people like it. They're like, it is cold in here. That was cool. Do it again. I remember one time years and years ago, you know, I forgot to warn a patient about what they would feel. You know, you get in a rut and just you're busy, and I accidentally forgot to tell this girl what she'd feel. She had this horrified look on her face when I came out and we were done with the test. She thought for sure she left a puddle on the table, you know, but never seen it done. Never seen anybody pee their pants, but they swear they do it, okay? Of course, I usually tell people, I've never seen it done, but you're my first patient. But anyway. All right, so after that's all done and you're done with the test, hydration, my friends, okay? Drink a few extra glasses of water more than you normally would that day. That's just gonna help protect your kidneys even more. It's gonna help flush it through, basically. It's gonna help your body just flush the contrast through and help keep your kidneys hydrated, all right? So, hey, listen, I hope this helped a little bit. You know, over a couple decades of being in the industry and seeing my poor patients, you know, the scared looks on their faces and the you know, the frustration and the disappointment of, I didn't know I had to do all this. You know, they would have been okay with it if they were told ahead of time that it was going to take a whole extra hour, you know, or if they needed contrast, all that good stuff. Education ahead of time is the key. And if I can help you guys at all, you know, please leave comments. If you have any questions about anything else, I mean, my primary area is CT scans, okay? So if you have any questions about any other CT scans, or, you know, I'm not a doctor, obviously, but, you know, I've been on the ground and in the trenches for years, so I would love to help. I would love to be able to make it a smooth transition for you, the patient, going from the doctor's office to the imaging facility, whether it's a hospital or an outpatient facility, you know. And usually any tech that's worth their salt will prepare you, okay? That, like I said before, they will pick up on what's going on with you, and they will try to head your anxiety off at the pass and all that good stuff, all right? So please, any questions that you have, let me know. I can make another video about another exam. Any comments? You know, have you had good experiences? Have you had bad experiences? What, you know, what do you wish would have happened if it was a bad experience? Let me know, all right? I hope you guys stay safe. I hope you don't need CAT scans in the future, but if you do, let me know. We can take care of this anxiety or whatever. You know, there's nothing more satisfying too than having a good interaction with a patient, with you, and knowing that, man, you came in scared, or, you know, and we alleviated that fear, and you left smiling and happy and relaxed, like, oh. So anything we can do to help, want to bridge that gap. I have seen too many times a doctor writes an order, the patient comes and has no clue what they're getting themselves into, and they're scared, they're upset because of the timing and all of the, oh, just one more thing, oh, just one more poke, oh, just this and that, and you're gonna do what, you know. But if you knew as a patient ahead of time, you would be ready for that and expecting it. It's all in the expectation, okay? All right, well, I hope I can help you. Let me know. You guys have an awesome day. All right, bye-bye.